Good evening, ladies and gentlemen. This is Aasif Shah. Uh, this is Epillo Health Series episode 1. We are joined by Dr. Rimy Dey, who is an emergency physician at Paras Hospital, Gurgaon, who has been a frontline healthcare professional in the nation's fight against COVID. So we'll be asking a few relevant questions to doctor and expecting that doctor will shed some light on the issues revolving around COVID and population health. Hi, doctor. Good evening.
Hello, good evening, Aasif.
Good evening, doctor. Doctor, I'd like to start this conversation by this question that what are the societal challenges for health experts? We have heard a lot of things that, during this fight with pandemic, doctors who are working overtime and, 24 hours on duty, they have been facing few issues like housing and other things. Can you shed some light on what are the challenges that health experts had to face during this period?
Okay, so I'll share from my personal experience. I've seen a lot of people from my fraternity, young doctors, who have been doing COVID duties relentlessly for the last 1.5 to 2 years now. And they have been posted in places far off from their residences, and they are living, putting up as tenants or hostelers in places. And because the virus was new and the fear was really high among the general population, so stigmatization was there. And there have been many instances where we've read news of doctors being asked to vacate their places of stay, or doctors being bitten up by people in the community, saying that you are the sources of the virus, or you may be the probable source of the virus. So that is one. Stigmatization is one thing, the social aspect of COVID-19 that the healthcare professionals have had to face. Second was the constant fear, because as the virus is new for the population, so it is for the fraternity of healthcare providers. It is a new virus for us as well. In our years of experiences, we have not seen a pandemic of such dimensions. So it was a new experience for us, and we were also fighting the unknown. It was a fight against the unknown, and the fear that we really might be carrying the virus back to our home, to our loved ones, to our near and dear ones. That fear was there. I lived with my father and my brother, and I had this constant fear that when I go back from my hospital duties, I'll be carrying the infection with me and infecting my father, who's a diabetic, who's a hypertensive, with many comorbidities. And third was the isolation. Many doctors like myself, when we were doing COVID duties, we would be doing the shifts for 10 days, and then 10 days will be in isolation or quarantine. So the 20 days will be away from home. And otherwise, we would see people on social media, being on home, working from home, and doing all those, social gatherings with their family over phone. We were, denied from all these. We never had work from home. We never had lockdown. There was no lockdown for us. We had to work despite of the whole country shutting down. So that also brought in a distress kind of for many of us in the community, many in our fraternity, that we were working 24/7, and yet there were cases of violences against doctors, or healthcare professionals, despite of us giving our best, and despite of thousands of doctors and frontline workers losing their lives in the line of duty. There were still cases of violence reported because of the anguish of the general population towards the certain instances of deaths, and unfortunate deaths and loss of lives. So the violence was instigated wrongly towards the doctors or the healthcare providers. So that was also a cause of stress or social distress, or challenge that we had to go through.
Doctor, why do you think it happened? Although it's very commendable that it was a war zone and you people were on the front line helping, to imbibe more care into the system. But why do you think, if you take India as a scenario, that why did it happen in India? Why was there a reluctance or societal challenges? Why were they placed for health experts? Although you were helping us, right? We were at a war zone and you were on the front line. So why did it happen?
Yes.
Why do you think so?
Yeah, see, why did it happen? This is not an isolated case in India, because I have read case reports of such instances happening in Italy, or such instances happening in US or China, or like any country that's been through. This is a pandemic. You really cannot predict the social temper. You cannot really predict the or you cannot streamline the anger or the frustration of the population. They are angry. They are in distressed. They are sad. They are anxious. There's fear. So it will be projected towards anyone's. In a healthcare system, the doctor or the healthcare provider is the first and the only line of contact with the general population. In the hospital, a person goes, the only person he sees as or things is like, for instance, we doctors, we were there and we were like, okay, they thought us to be the representatives of the government, that government is failing to provide us basic food or like ICU beds, so like it's your fault, so hit the doctors, something like that. The social distress, it cannot be scaled that way. We cannot really say what was the causative factor. There's no fault from their side, the general population, because they were distressed. They were seeing that somewhere or the other, the skeleton of the healthcare system was getting exposed, that we really need a better healthcare system. Our shortcomings, our loopholes were getting exposed some way. And on the other hand, were us who had to work with all the limited resources we had. See, as a country, we are still a long way from being a developed nation. And even developed nations like Italy and US, if they have seen such war zones, then and India, which is such highly populated country, where the ratio of patient to bed is so low. So we are anyways, we are, yeah.
So basically, doctors were the only point of contact, and all the emotional and expectational burden of the people, were flown down on doctors who were there on the front line. So, Dr. Rimy, I would like to ask, there have been a lot of questions floating around COVID and, what steps to take and what steps to not take. So, are COVID after effects long term? Anybody who might have suffered from COVID, most of the people have. Most of the people have had fevers, or many people got tested and it was confirmed that it was COVID, or many people also did not test and yet it was COVID. So for anybody who has been through COVID, are the effects long term?
See, COVID itself is a self-limiting disease. That's what we've studied in literature, that anyone having COVID, it your body, your immune system tends to be down, or with the use of a supportive treatment, your body should contain a COVID infection within 4 weeks. But COVID itself we have seen long-term COVID as well, in the sense that many people, this terminology, post-COVID syndrome or long COVID. Long COVID is used for people who have COVID symptoms after 4 weeks of them having active COVID infection.
So that for anybody who might have suffered from COVID, so are COVID after effects long term? Should people be worried?
Okay. So COVID, as we have read in popular literature, is a self-limiting, self-restricting disease, meaning that any individual suffering from an active COVID infection usually has the symptoms or till 4 weeks of having the infection. But it's been seen that there are many defaulters. People have had COVID infections for prolonged duration, more than a month, say for 2 months, 3 months, or for 4 to 5 months. So these people are known as long COVID cases, and the terminology we use is post-COVID syndrome. Okay. So this itself is a long-term side effect or a long-term after effect of COVID. The symptoms in post-COVID syndrome or long COVID are similar to COVID infection, like fever, fatigue, difficulty in breathing, body ache, etc., and so on and so forth. Second, during an active COVID infection, COVID virus seems to attack many organs. In fact, after COVID infection is over, can show its after effects. For instance, in heart, we'll see a chunk of population coming to us with post-COVID myocarditis, which is an infection of the covering of the heart or the muscles of the heart. Also, in patients who already have had prior heart attacks, come to us with second or third episodes of heart attack, which has been triggered by the COVID infection. Okay. And similarly, COVID also increases the chances of a person having stroke, because COVID is a hypercoagulable disease wherein blood clots are formed. So chances of stroke increases, chances of like having Guillain-Barré syndrome, which is a type of paralysis, it increases. And in old age, the chances of having Parkinson's disease, Alzheimer's disease, that also increases. In kidney, we can see in long term that COVID patients who already have had kidney diseases, they come to us with kidney disease which is relapsing or which is not controlled by diabetes. And also there we see like M.B.B.S, which is multi-organ dysfunction syndrome. Like at the same time, 2 or 3 organs of their body stops functioning or is misfunctioning. So yeah, these are the long-term effects. But
So are
because it's a
this
very
more
new
common?
virus,
Yeah, are this more common in younger people or elder people? So what have you observed during your experience with COVID?
in older people, the like the stroke, the MI, the cardiac events we have seen mostly in older people. In younger people, we have seen like post-COVID myocarditis, isolated cases of post-COVID myocarditis, or new heart attacks, new strokes. Okay, so we have seen in all the age groups, and there's no data as of yet available as to which age group is more affected.
Exactly. So, doctor, can we consider sanitization as a replacement for washing hands? As sanitization has become a basic all through this pandemic. So, can sanitization be considered as a replacement for washing hands?
See, sanitization and hand washing are both very good hygiene practices, but each has its own time and place. Uh, if we are working in the food industry, if we are working in, if we are like in a place where we are handling raw meat, so that ways we are in constant contact with something dead or something. So and our hands tend to get greasier or tends to get dirty, visibly physically dirty. In that instances, washing of hands is advisable. But in other places, in clinical settings like in hospitals, or when we are in places where our access to a tap and a soap is limited. For instance, we are in public places, we are in a bus, we are in a train, we are in a movie theater, we are in a public gathering. So in such cases, a sanitizer comes handy.
Yeah. So, what are your views? Does sanitization actually kill or minimizes bacteria, or washing hands is the ultimate thing?
Yeah, see, basically, the rationale behind why we are being advocate, why we are being told we have to wash our hands or sanitize our hands, is because we are being told that it will kill the virus. So we'll have to understand the science behind it. See, the virus, the novel coronavirus, it has a lipid envelope. Lipid means a layer of fat. So what a soap does, or what a hand sanitizer which contains alcohol does, is it destroys the lipid envelope, and that way it destroys the virus.
Exactly.
So washing your hands also is effective. And similarly, a hand sanitizer which has an alcohol content of more than 60% is also similarly effective in killing the virus. So yeah, not comparing the two, but an absolute lifesaver. Or in a country like India, where a sanitizer costs 60 to 100 bucks, and the our majority of the population doesn't even earn up to that much money in a day. For them, hand washing is the most sustainable means of keeping their hands safe.
So, doctor, a lot of people have been vaccinated, and India is already, in the drive for vaccinating all of its people. So, is taking paracetamol in advance after vaccination helpful or not? Because, most of the times it has been observed that your body temperature raises after you are vaccinated. So, is it like taking paracetamol in advance helpful or not?
See, as a doctor, I would not recommend that. And if we go through our standard bodies like WHO, they also advocate, they do not recommend using a paracetamol before vaccination or after vaccination when the person has not yet developed fever. Why? 3 reasons. First, because the mechanism of action of the vaccine, these are very new vaccines, we do not know there as of yet, we do not know if a paracetamol taken in advance can hamper the action of the vaccine. First. Second is, see, when we have a fever, that is a good sign. That shows that our body is developing immunity towards the virus. So us having a fever, and with before it, if we take the vaccine, like if we take the paracetamol, that like and we do not get a fever, that is not a good marker. Instead, we should get a fever and be happy that we've got a fever and our body is actively producing antibodies against the virus. And
So, which briefly
third,
is that you're saying that there can be a pharmacodynamic or pharmacokinetic reaction if you take it in advance without need. It can interact with
yes,
the vaccine.
yes, I think that after taking the vaccine, if we develop flu-like symptoms, after that taking a paracetamol would be advisable, but
Hmm.
not before we have developed any fever or any body ache. Yeah,
Okay. Is it possible to have COVID even after complete vaccination, like after being vaccinated to or two doses, or if you take?
absolutely. Absolutely. No vaccine in the world is 100% effective.
Okay.
Every vaccine, and especially in cases of these viral vaccines, see in US they repeat the influenza shots every year. They
Okay.
take booster doses every year. So similarly in COVID also, this is not 100% effective vaccine. Anyone who has taken both the shots of COVID vaccine can have a COVID infection. But the function of vaccine is that it will decrease the severity of the disease.
Okay.
Because
So it
after two
depends on the
doses,
viral load. I'm
yes,
pretty.
no, like after two doses, our body will start producing, even after a single dose and after two doses, our body will start producing antibodies against the virus. So even if we are infected, the severity of the disease will be controlled by our body's immune system. We'll not have a very severe disease like we would have had we not been vaccinated. So that's the rationale of vaccination.
Doctor, is black fungus associated with COVID, or is it a completely new disease? We have heard a lot about, black fungus being an associated disease for especially elder people, suffering from
Yeah.
COVID. Many reports said that it is because of industrial oxygen being used and XYZ things. So, what are your views on this?
See, black fungus or mucormycosis, as we scientifically call it, is not a new disease. It's been there since the beginning of humanity because it's a fungal disease, and this fungus is found in our ambience. It's in our skin, it's in soil, it's everywhere. So previously, it was seen only in immunocompromised patients. For instance, in patients with HIV/AIDS, or in patients undertaking chemotherapy, patients who are who have cancer, patients who have severe diabetes. What has happened during COVID is the prevalence of the disease has increased manifold. There are several reasons to it. First is because COVID itself leads to a decrease in immunity of the body, and plus there are many people who have been infected with COVID, the older age group, they have several other comorbidities like diabetes. And diabetes it's also an immunocompromising, it also brings down the body's immunity. So a combination of COVID and diabetes, brings down the immunity manifold, and that has led to this mucormycosis cases evolving in several numbers. Secondly, one of the mainstays of COVID treatment was the use of steroids, oral or IV. So
Hmm.
steroids also are immunocompromising. They hamper our body's immune responses. So this rampant use of steroids is also another harbinger maybe of these newly evolving or the increasing prevalence of such fungal diseases like mucormycosis, aspergillosis, etc. It's not a new disease, but just that the COVID infection and the accompanying compromised status of the people that's come with the virus has led to increasing prevalence of the disease.
Okay. So, doctor, as we have heard that another wave of COVID is doing the round. We do not surely know whether it's coming right now or in the next few months. So, are there any particular symptoms to detect the upcoming COVID wave in patients?
Uh, Nothing like that. I think, see, the first wave and the second wave, almost similar symptoms. The classic flu-like symptoms of fever, body ache, running nose, loss of sense of taste and smell. Second wave also was similar. Just that we've seen increased, young people coming to us more than old. That was because the old people had already received 1 or 2 doses of the vaccination. That's why the young population got it. But the signs and symptoms have been the same. COVID anyways is a respiratory virus, so the signs and symptoms of any other subsequent waves will probably be the same. Just that we'll have to look what are the like proportions. See, first the classical symptoms will always be there. We'll only have to see what's coming new, because in the second wave we've seen that many people came to us with symptoms of vomiting or diarrhea, with gastrointestinal symptoms, or many people came to us with conjunctivitis or red eyes. So these kind of subtle changes in the symptomatology may be there, but not major changes. It will still be a primarily respiratory and a fever causing flu-like virus only.
Right.
Yeah.
So during the quarantine, patients have suffered a lot. Doctors have suffered a lot. So what do you think are the main sufferings for patients, according to you? They have been cut out. They have not been able to access the healthcare system. They have not been able to access the, societal things that they used to access. So what are the main sufferings, according to you, for patients being quarantined?
Uh, First thing, I think that suffering streams from is anxiety or distress or the fear of the unknown, which has happened to us. In the first wave, it was more. In the second wave, it was at least controlled in the way that, fake news and news coming from like very unidentified sources, which were like, and constantly you were switching on the TV, you're switching on any social media, or you're looking at any social media. There are constant, like, fear regarding like people lined up outside the crematorium and so on and so forth. So this fear, anxiety, distress was one of the major causes of why patients had suffered in quarantine. Second was the stigmatization. During the first wave, like an entire colony used to be shut because one family there was tested positive. So the stigmatization, the social isolation. Third, from the last 1.5 year, the financial constraints have also started. Like, people not getting to go to their workplaces, many people going back to their home, quitting jobs because of this thing. So this financial constraints. Fourthly, like these things like fear of losing the near and dear ones, not getting access to hospital beds, not getting timely medical care, and also, like, if someone's near and dear one is dead, they don't even get to bury or cremate
Exactly.
the body. That fear also is a very big factor, which has caused a lot of distress and a social, kind of disharmony in our minds, or played up with our mental health and cause our psychosocial well-being to be hampered.
Basically, mental health aspects have distorted a lot.
Yes,
Uh,
yes, yes.
So, doctor, as you know that during and after COVID, teleconsultation is doing rounds and have picked up a lot. Although it has been present in the country from last many years, but this is the time it is seeing exact usability. So, what do you think? How is teleconsultation helpful for COVID treatment, or at least a COVID consultation? How can people make benefit from connecting with a doctor virtually at your fingertips?
I think teleconsultation has provided to be a boon, especially in a country like India, where, see, out of 100 cases, 80 cases were manageable at home. 80 cases did not need the patient to visit any healthcare facility. And like out of 80, around 60 or 70 people were asymptomatic. They did not need any treatment. And 10 or 15 would need basic treatment, like some oral drugs and all, which, if they had to rush to the hospitals, would have been an unnecessary burden on the healthcare facilities. So
Exactly.
they getting to avail these facilities from the comfort of their home through teleconsultation has or can provide to be a boon in the long run also, in that our hospitals will not be overburdened. Instead of seeing 100 patients, of whom 80 patients are not very sick and only 20 are sick, we can solely concentrate on the 20 patients who are sick and need our immediate care than concentrating on the 80 patients who need just home-based treatment. So that way, teleconsultation has proved to be very helpful in this
So
COVID
do
scenario.
you assume it to be an alternative, or do you imagine it to be a mainstream in the coming future, teleconsultation?
Uh, See, teleconsultation is a very new thing.
Hmm.
Very, like, I think 20 years back, 20 years back, India didn't have any teleconsultation. So it's a very new and upcoming thing. And probably in the coming years, and seeing how themselves nowadays are quite aware of they also not want to go to hospitals and expose themselves to unnecessary infections, unwanted infections. They want to avail the services of a doctor or a healthcare facility from their home. So I think teleconsultation in the long run will be a mainstream mode of getting treatment, or a module of, like, it will be a modality. I don't think it will be a stream or a branch of medicine. It will be a medicine as whole, and which is a good thing. I think I will, in such a big, in an era of such digital progress, if we are availing every facility, if we can order food from home, if we can order every service from home, why can't we avail healthcare services from home? Something which, yeah, I think so. Teleconsultation has a big, bright future.
Which means that, doctor, you
in the world, in a country like India.
So, being a doctor, are you comfortable with teleconsultation or treating your patients for specifically?
Absolutely.
So,
absolutely, I'm very comfortable in treating patients. There are a few cases where we want to inspect the patient. We want to check if there's a physical wound, if there's a physical cut, if the patient really needs some physical examination from our side, medical examination, then I would want to check the patient. These are the limitations of telemedicine. Otherwise, for a general bigger chunk of population, I think video consultation or video thing works, because many symptoms are not covert physical symptoms that need to be examined. So these loopholes are there, but new guidelines are coming out for teleconsultation. 2020 also we saw new guidelines for telemedicine. So these way, I think video consultation or video thing works, because many symptoms are not covert physical symptoms that need to be examined. So these loopholes are there, but new guidelines are coming out for teleconsultation. 2020 also we saw new guidelines for telemedicine. So these way, newer guidelines will keep on guiding us towards having better telemedicine facility, I think.
Yeah, new guidelines and new technologies nowadays.
Yes.
We as a digital health company are trying to combine the power of telemedicine with a lot of IoT devices, so that you do not lose the doctor's touch. As you said that sometimes it is important to inspect. So telemedicine connected with peripheral screening devices, I think, can do the magic that's required.
Yes, absolutely.
Do you feel that patients are getting comfortable with the OPD checkups through teleconsultation? You being a doctor, you said you are yourself comfortable. Do you think?
Because when I'm working in the hospital, I attend to a lot of telecalls. Like, many patients call us and tell us these are the symptoms, and this patient already has shown to we are a follow-up of this and this. The patient has this diseases. Right now, he's defaulting on these drugs, and these are the symptoms. And I can advise them over phone. What's the need of the hassle of bringing the patient, using an ambulance, using the whole getting the whole family to the hospital, them getting exposed to a wide range of virus and then going back home, when they can avail it from the comfort of their home. So I'm comfortable with the idea of teleconsultation. Many doctors are, I think, majority, and I think of the chunk of the population of healthcare providers are comfortable with the idea of teleconsultation, because it's easy, it's safe, and it's effective, and it leaves the patient and the doctor both content. I think the patient also, when the fear of going to the hospital and stuff, it comes down. I think they anyways are mentally also a bit relaxed that way. We can be at our home and assess the doctor anytime of the day. So yeah.
Exactly. But I surely feel that technologies like teleconsultation and digital health technologies are acting as an amplification to the care that healthcare workers are already providing to the population.
Absolutely. Yes.
With that, Dr. Rimy, thank you so much for your insights and information. And we'll connect with you again on another series, another episode. Thank you so much for your time.
Thank you for having me here. Thank you to Epillo, thank you to Aasif, thank you to Cherry. Had a lovely conversation. Yeah, thank you.
Thank you.